Hi, my name is Anastasia, and my group members are Sandra, Sophia, and Ellis, and we will be speaking about mental health. The question is, what is mental health? Mental health affects our emotional, psychological, and social overall well being. It affects our day to day living, our friendships, our relationships, and our physical health. Bad mental health can be signs of depression, stress, anxiety, paranoia, PTSD, OCD, and more. As psychiatrist Timothy said, mental health is a state of well being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make contributions to his or her own community. There are many signs of bad mental health, and the first thing is to actively acknowledge what is going on within yourself. Some of these symptoms include withdrawing from loved ones and avoiding activities, sleeping and eating too much or too little, low energy, bad mood, using substances that can alter real life, such as alcohol, drugs, marijuana, pills, anything in that category, unable to complete day to day tasks, having reoccurring memories and intruding thoughts, meaning you're not living in the present and you're thinking about either the future or the past, having thoughts of suicide or causing harm to yourself. These are all visible signs to a depleting mental health that everyone should be aware of. There are a couple things we can do to better our mental health, such as communicating, making it more socially acceptable, normalizing going to therapy, and taking time for self care. So we thought we would share our personal experiences regarding mental health. And I recently, since about a year ago, and I believe it's due to the pandemic, I started having panic attacks, depression, and anxiety to such an extreme amount. I had no idea how to deal with my emotions. So I began seeking professional help, and I started talking to my friends a lot more about how I was feeling, and it turns out we had many of the same issues going on. Ellis dealt with social anxiety and just felt quiet in social crowds and walk away from groups because he would feel like it was too much to handle. To Sandra, mental health is something that's extremely important to her because she feels if she's not taking care of herself, then she cannot take care of anyone else. Sandra is also a mother, so it's just as important for her to take care of herself because the outcomes can affect the child. Sandra views mental health as an extreme priority. Sophia, on the other hand, was affected by COVID by not wanting to go outside as much as she usually would, even though the pandemic is coming to an end. She'd rather be home alone, and big crowds cause social anxiety to her. On this slide, there are some statistics regarding COVID 19's widespread impact on mental health. It is said that between the beginning months of the pandemic, 69% of adults reported having difficult days throughout the week, and this percentage has increased to 73% by the second week of July. When it comes to anxiety, worry, low interest, and depression, the numbers just seem to be increasing in all countries. COVID 19 has affected people's mental health in many ways, such as causing COVID-19 has affected people's mental health in many ways, such as causing confusion and anger, fear of the virus along with catching the virus, frustration, boredom, grief due to loss, depression, anxiety, and many more. Due to COVID, many people have experienced negative effects on mental Due to COVID, many people have experienced negative effects on mental health, such as an increase of unemployment, and interference with people's daily routine, isolation from social gatherings and seeing loved ones, and an increase of people with poor mental health, such as anxiety, depression, mood disorders, and the list goes on and on.